So in part 2 of this video, I know I said I was going to do this in part 1, but I changed my mind, and it's good because the part 1 video that you did for homework, that information stays the same regardless. What does change over time is obviously our statistics and trends relating to our health data in Australia. So these are the latest statistics and trends relating to health and core 1 for HSC PDHPE. So this is obviously filmed in 2023. It is based off the AIHW report, which got released in 2022. So I'm going to go through and give you the statistics and trends that you need to know to answer your questions for PDHPE in 2023, and this will also be applicable for 2024. Now, interestingly enough, you do not need to memorize certain statistical numbers, okay? So I'm going to give you some numbers today, but you don't need to know them. What you need to know and be able to explain in your answers are the trends, as in, is it increasing or decreasing, or is it staying the same? And then with those trends, why? Why are those things increasing? Why are those things decreasing? That is where you need to elaborate in your written responses to be able to get the best results that you can. Furthermore, to try and address the issue of people not listening in the videos, which is super annoying because you're actually not learning anything, you're just writing stuff down, I am going to verbally tell you these trends along with the stuff that I write on the board. So let's do it. All right, so the first statistical trend we're going to go through is life expectancy. So if you remember from part 1 of the video, life expectancy is how long you should live determined at birth, okay? So the current life expectancy is for people who are born today, for example, all right? So your life expectancy is a lot different to my life expectancy. What you need to know is that it is continually trending upwards, okay? It's good, all right? Males, a male who was born today, or in 2023, should live around 81.2 years. 81.2 years, okay? Females, 85.3 years, okay? So obviously there is a difference there between males and females. There is a gap. The gap is actually closing, which is good, okay? So the gap between males and females used to be a lot larger, is now a lot smaller. So we're looking at a gap of 4.1 years between males and females. And we'll address reasons later on in the unit as to why females live longer than males, etc. But why overall is life expectancy continually trending upwards, okay? First measure is that we've got reduced infant mortality. So if you remember from the first video that I did, infant mortality is basically the rate of mortality per 1,000 live births, okay? So that's going down, okay, because obviously there's better care in the hospital system, both private and public hospital systems. So that directly feeds into life expectancy, okay, because you can imagine if a whole bunch of people were being born and then they unfortunately passed away, like within that first 12 months of life, that's drastically going to affect this statistic of life expectancy, okay? You can't expect to live long if, you know, the average was less than 12 months. So that's our first real measure that you need to talk about in your answers. The next one, we've got improved overall health measures, okay? So like food quality, as in like not only the availability of fresh food and produce, but also the quality of that food and produce. So it's lack of disease and all that kind of stuff, you know, and that can go along with agriculture and reasons why, you know, such as, you know, pesticides and herbicides. And then there's also the organic movement, which, you know, think that, you know, you shouldn't eat anything with pesticides and herbicides, but it actually hasn't been proven by science that that's any better. So people that like eat all organic food necessarily don't live longer than people who don't eat organic food. But what people who do live longer are the people that eat more fruits and vegetables and fresh produce as opposed to packaged foods. Water quality, so obviously the water that you get out of your tap is healthy to drink and you should drink it. Yes, it is fortified with fluoride, okay, and that is important for your teeth, okay? You should do that. Don't just drink bottled water all the time. People who continually drink bottled water over many years actually end up with brittle teeth. And then you get to old ages, and then the funny thing about teeth is that while you think, oh, you just need them to chew your food, your mouth is like the first defense system for your system, because most of the time the things that go inside your body come from your mouth. If you have disease and infection in your mouth and then you're swallowing that down into your body, that can actually become a very big systemic issue in your body, and people actually get really, really sick, and to the point where they actually pass away from simply just having like bad mouth disease, okay? And finally, like sanitisation, so the cleanliness of the environment, all right? Yes, there's a little bit of rubbish here and there, but it's not bad, and we live in a very good community area that actually do sanitisation really well, okay? You look at other countries, so remember, we're just talking about Australian statistics here, but you look at other countries where they don't have great sanitisation systems, and you know, people just get disease from the side of the street because it's gross. So next one, we've got medical advances, so things like immunisations, vaccines, okay, antibiotics, MRIs, chemotherapy, okay? All of these things aid at either A, stopping disease from occurring, or B, curing disease in the first place, or C, treating disease so that that person can live longer, okay? So chemotherapy is obviously, we look at cancers, all right? Cancer is, unfortunately, it's sort of overall it's on the rise. But that's just the burden of cancer. It's actually not on the rise for cause of death, okay? Because of things like chemotherapy, people with cancer are still actually able to live a longer life and, to a degree, a normal life, all right? Yes, if you have to go through chemotherapy, that sucks, and there are lots of unfortunate changes that will have to happen in that person's lifestyle, but they can still get out and around with their kids and, you know, just enjoy what time they have left. And ideally, chemotherapy will actually stop cancer and put it into recession so it doesn't come back at all. Whereas, you know, like 15, 20 years ago, chemotherapy was not so good. National health strategies, you know, such as sun safety, road safety, okay? You can't basically watch TV without seeing an ad for either sun safety or road safety or healthy eating or being active and all that kind of stuff. So they're government strategies that they've put money into, especially towards the states, to then fund and reduce the incidence of these things. So like sun safety, obviously that's going to directly reduce the incidence of skin cancer, which used to be a major cause of mortality and morbidity in Australia, and it's going down. And road safety as well, okay? That's continually going down as well, which is good. Education, so, and like bias, PDHPE, all right? Core subject, we do try and push education around health issues so that everybody gets at least a basic understanding of how to look after themselves, okay? Without that education, people can just get sick because they don't know any better. And the last one here is another reason, cooperation between services, okay? So you used to just go to your GP and your GP should hopefully fix you, and if the GP couldn't fix you, then you should try a different GP or maybe go to a specialist or something, so the next level up. But now we are acknowledging that there are lots of conditions which don't necessarily need specialists, you know, like mental health illnesses, and GPs cooperate with, you know, social workers and mental health services to refer patients to get the extra help that they need, all right? So it's not necessary, it's not actually giving them a tablet or anything. I mean, obviously a GP can prescribe antidepressants and anti-anxiety medication, but also they will also try and refer to a social worker first to try and talk about problems, okay? Because we know that communication is a very good key at reducing anxiety, depression, and any fears and worries that may be going on in people's lives. So overall, life expectancy is continually trending upwards, and the male, in case you missed it the first time, male life expectancy currently is 81.2 and females is 85.3. All right, so next one, infant mortality. Okay, the infant mortality rate is continually trending downwards. Okay, and I did mention this before. Why? First of all, you've got better care in hospitals. Okay, the hospital systems they're cleaner. The nurses and the doctors are better educated. Okay, you always have someone on hand to basically help with the birth, and in the pre-birth. Oh, I should add that too. Pre-birth care. So pre-birth care, you know, checking in. And then birth, and then after the birth, you've got home care post-birth, so hospital system will actually send nurses out, community nurses to your house to check on, you know, not only bub, but also mum. How's everyone going? Are we adapting well? Any issues? So then like, for example, Liz had trouble breastfeeding. So with that, we basically had a nurse who would come out and assist with that process once we were out of the hospital and at home, and they continued on with that care for about 6 months for us, because then we didn't need it anymore. But the hospital system does offer like a 12 to 18 month care system after birth, okay? So we're really trying, there's lots of people touching base with mum and bub and the family, making sure that everyone is healthy after birth, okay? And also just pre-birth care, which I added in before there. So before you actually have birth, you should have actually gone and seen a doctor and a specialist many, many, many times, okay? So scans, checkups, so like things like ultrasounds and all that kind of stuff, heartbeat scans. I should write this down. Oh, that's not how you spell ultrasounds. Sorry. So pre-birth, you've got ultrasounds, heartbeat scans, blood tests, and all of these things are opt-in, okay? But most of the time, parents do opt into it unless it becomes an invasive test. So there are some invasive tests which actually need to be taken, like a blood test from bub itself, or they take like a skin fold from the baby. And that's completely opt-in, all right? Because obviously it's still growing inside the womb, and a lot of parents don't want that done, and that's okay. But they would only really recommend or suggest those things if one of these other scans turned up something a little bit abnormal, all right? But anyway, all of these cares are in place to make sure that bub is born healthy, and then mum is healthy, and then everyone's healthy after birth as well. So infant mortality continually trending downwards. All right, mortality rates. So the causes of death in Australia, okay? So a cause of death is determined by basically what the doctors deem as the reason why someone passes away, okay? These are the top 5 currently overall for males and females combined, all right? Number 1, you've got coronary or ischemic heart disease, okay? So sometimes you'll see it referred to as coronary heart disease, sometimes you'll see it referred to as ischemic heart disease. It's all the same thing, it's all heart disease, AKA heart attack, all right? Why? Why is heart attack still number 1? Like after all these years, it is still the biggest killer in Australia, okay? Mainly because people are overweight, people eat a poor diet, people have a lack of exercise, okay? All of these lifestyle factors which you know, and you need to be able to elaborate on them in your written responses, okay? Still number 1, okay, after all this time. So back to what I was saying, coronary heart disease, number 1, and it is trending downwards, okay? Which is good. Right? Less people are dying from coronary or ischemic heart disease, all right? Now, that may be due to, health programs and people eating healthier or exercising more. What it's actually more likely attributed to is because they're actually dying from something else. Number 2, dementia, okay? Dementia is trending upwards, okay? It is getting worse and worse. The reason why, okay, the main reason why is because we are living longer. So we already spoke about how life expectancy is continually going up. Something's got to give. After you live a certain amount of years, something's got to give out. And unfortunately, if it's not the heart, it's the brain, okay? So dementia is on the increase. It is, and I'll get to it in a minute, but it's actually the number 1 cause of death for females these days because females live longer than males. And the reason dementia kills people, okay, and I get this question all the time, is like, how is dementia actually fatal, okay? So if you don't know, if you haven't ever experienced someone with dementia, you're very lucky. My pop, unfortunately, passed away from dementia. So dementia is actually fatal for 2 reasons, okay? If a person has dementia and then they just pass away, the doctors can say, well, they passed away from dementia, okay? Secondly, though, dementia is a condition of the brain where you start to forget things, okay? You forget people, you forget friends, you forget your memories, okay? There is a lot of, like, when I was visiting Pop in his last few years, he didn't know who I was, he didn't know who his wife was, so my grandma, he didn't know who mum was. It was horrible, okay? And that forgetfulness actually impacts the body. So you forget to do things like eat, you forget to do things like drink water. It gets to the point eventually where the nervous system breaks down enough that your nervous system forgets that you need to breathe, and it forgets that you need to beat your heart, and then they pass away from dementia, all right? So dementia is number 2, and it's going up. And that could also explain one of the reasons why statistically coronary heart disease is going down, okay? I mean, ideally it's because of everyone having a healthier lifestyle, but we sort of know that's not true. But if this is going up, something's got to kill people, unfortunately. Number 3, cerebrovascular disease, aka stroke. Okay, so this is connected to number 1 for the same reasons, okay? Blockages of the arteries that travel to the brain, and that is our 3rd biggest statistic. Number 4 biggest statistic, malignant neoplasm of the trachea, bronchus, and lungs, okay? Malignant neoplasm is the fancy terminology for cancer. Okay, cancer of the bronchus, trachea, bronchus, and lungs, aka lung cancer. Fortunately though, trending downwards. And lastly, which is a bit of a curly one, chronic lower respiratory disease, aka bronchitis, emphysema. Hopefully no one's ever had emphysema, but you've probably had bronchitis at some point in your life, okay? It's a common thing that is treated with antibiotics. It's, basically, an inflammation and infection in the trachea, bronchus and lungs, okay, can stop you breathing to the point where if you can't breathe, you die, right? And emphysema is obviously the worst version of this, which impacts on the lungs directly, and the main contributor to emphysema is smoking, all right? So they're your top 5, and I'm not going to give you the numbers because like I said, you don't need to know them, but you need to know overall that they are all trending downwards except dementia, because it's going up. So now we'll go through males and females specifically. All right, so we've got our leading causes of death here for males and females. Okay, should stand off to the side. So males, number 1, coronary heart disease. Ischemic heart disease, it's heart disease, heart attack, okay? Number 2, dementia, including Alzheimer's diseases, okay? So that is on the increase. However, interestingly to note is that while it's on the increase, and while it is number 1 for females, there are still double the amount of people dying every year from heart attacks for males than there is for dementia, okay? So yes, it's on the increase, but it's going to take a long time for dementia to be the number 1 cause of death for males, specifically, okay? Part of the reason you could explain that is due to, obviously, 1, males don't live as long, and number 2, males are more likely to have poor diets and, not exercise enough, especially when you get into older years, etc. Okay, but the diet is the big one. Number 3 for males, you've got lung cancer and it's going down. Number 4, cerebrovascular disease going down. And number 5 for males specifically, prostate cancer, okay? Also going down, all right? So the top 5 causes for males, once again, were coronary heart disease, dementia, lung cancer, cerebrovascular disease, and prostate cancer. All trending downwards except dementia, okay? Now, females, on the other hand, we've got dementia, number 1, okay? And it is significantly number 1. You can see from the graph there that it is much higher than number 2, which is coronary heart disease, okay? So number 1 and 2 swaps positions, and that is trending upwards, okay? Coronary heart disease, number 2, cerebrovascular disease, number 3, lung cancer, number 4, and breast cancer, number 5, okay? So you can see in the number 5 positions for both males and females, they've got sex-specific cancers, okay? Prostate and breast, all right? Yes, males can get breast cancer, but it's extremely rare. Just someone always asks me that, okay? Why are the reasons for these? Why is the significant change between the two? Obviously, other than the prostate and the breast cancer, most of the other things are pretty much identical, okay? The main one being dementia, which we've already talked about, okay? Dementia, obviously, for females is on an increase, and it is number 1 because they live longer, all right? But also they have generally better diet, okay? Less likely to be overweight, all right? And less likely to be overweight means that they're less statistically likely to die from coronary heart disease, and then dementia obviously overtakes that as number 1 for them, all right? This is in your class notes, but I do want to add it in here specifically, and I do want you to write it down. The combination of all cancers is the number 1 cause of mortality, okay? So sometimes in the HSC they ask you, what is the leading cause of death for Australians? And the options in multiple choice, for example, ABCD, one of the options is all cancers. That is number 1. When you add up the numbers for prostate, breast, skin, lung, etc., all of the cancers, they overtake coronary heart disease, dementia easily, all right? So that is the number 1 overall cause of death for everybody. But when you break it down into certain cancers, they're much lower on the list. And cancers are overall, like I said, trending downwards, due to treatments, chemotherapy, awareness, all that kind of stuff. All right, let's get on to the next one. All right, so I've got this nice little picture here from AIHW. So this is the causes of death by age category, okay? So we know what our overall causes of death are now. We know what our overall causes of death are when we split them into sexes, but let's look at different age categories, okay? So, and I'm probably just gonna cover the top 2, all right? we'll go through top 2 looking in this table, okay? So under 1, when you're under 1 year of age, it is perinatal and congenital conditions, okay? Number 2, other ill-defined causes, all right? And all of those things can be prevented through care in the hospital system, postnatal care, pre-birth care, all that kind of stuff. Next age group, 1 to 14, okay? Number 1, land transport accidents, okay? So the main cause of younger people, 14 and under, dying is car accidents, okay? Or pedestrian accidents, all right? So it's unlikely they're going to get a lifestyle disease like heart attacks and cancers and all that kind of stuff. It's basically they're dying from accidents or injuries, all right? Number 2, perinatal congenital conditions. Third age category, 15 to 24 years of age. Number 1, you've got suicide, okay? So this is unfortunately your age category. And number 2, land transport accidents, all right? So suicide, number 1, car accidents and pedestrian accidents, number 2. Number 3, I'll just mention accidental poisoning because that statistic is still actually quite high. Accidental poisoning is basically death from drugs and alcohol, all right? Then you've got the next age category, which I'm in, 25 to 44. Number 1, still suicide, okay? Number 2, accidental poisoning, so drugs and alcohol. Number 3, car accidents, land transport accidents. Next age category, 45 to 64. So you can see so far in the 4 age categories that we've covered, they've all basically been either, unfortunately, suicide or self-inflicted, such as car accidents and accidental poisoning. Not lifestyle diseases, just people doing unfortunate things, all right? Now we get into the age category 45 and above. So 45-64, we first of all see coronary heart disease, okay? So now people are starting to actually die from heart disease. So living 44 years of their life with a poor diet, lack of exercise, okay? They're overweight, they're obese. Now they start to pass away from coronary heart disease. Heart's had enough. Number 2, we've got lung cancer. Number 3, suicide. Next age category, 65-74, lung cancer, number 1. Number 2, coronary heart disease. Number 3, we've got COPD, chronic obstructive pulmonary disease, so lower respiratory disease, bronchitis, emphysema, that type of stuff. Next age category, 75 to 84, coronary heart disease, dementia is the first time it comes up, and lung cancer. And then finally, 85 and above, dementia, coronary heart disease, cerebrovascular disease. What's interesting about looking at it when you break it down into age categories is that if you go back and you look at the leading causes of death, okay, so the leading cause of death was coronary heart disease, it doesn't actually appear until 45 and above, all right? But then from 45 and above, it's constantly in number 1 or number 2, so all those numbers add up, all right? When you break it into sex-specific, okay, so you look at males, we just spoke about coronary heart disease, but interestingly enough, you look at females, okay? The number 1 cause of females' death is dementia, but it doesn't actually, it's not even in top 5 until 75 years of age. That actually goes to show you how long people are living, okay? So remember that life expectancy was like 85.4 or 85.3 or something at the start of the video. All of those people, okay, who are living that long are probably, unfortunately, going to pass away with dementia, all right? So if that is statistically number 1 cause of death and it's only really appearing in 75 and above, that goes to show you how much of Australia's population is in the 75 and above category. That's a lot of people, all right? And a lot of people are unfortunately dying. We will touch later on in this unit on aged care, okay? Aged care is like one of the biggest booming industries. Because people are living longer, they need care, all right? And then, so this will all come back. What you'll learn about Core 1 and the information that I'm covering is that all of this stuff is connected. So like in Core 2, for example, you get a question on principles of training. You just need to address the principles of training, okay? You get a question though, let's say in 6 weeks' time I ask you a question on healthcare in Australia, you need to actually combine a whole bunch of dot points from all around Core 1, including today's video on causes of death and the reasons why. So it all links in together. So that's it for our mortality rates. There's one more thing I want to cover with you, which is our burden of disease and years of potential life lost and what that means. Burden of disease is an interesting statistic because it actually includes mortality and morbidity. So if you remember, mortality is obviously cause of death. Morbidity is the rate of people experiencing disease and illness, but they don't die yet. So burden of disease adds both those things together. And then we have this nice little picture from the AIHW. So the 5 diseases that cause the most burden overall, so this is like burden on the hospital system, causes of death, okay, requiring home care, all that kind of stuff, all right? Number 1, coronary heart disease. Number 2, back pain and problems, all right? Like, that's not a cause of death, but as far as burden, as far as people experiencing those things and it impacts their life and they're needing medical treatment, it is number 2. That's significant, okay? And what causes back pain and problems? Lack of physical activity, okay? You lose the musculature in your back to support your spine and your spine gets wonky and you have problems. In fact, probably one of your parents or your grandparents at least have a sore back or lower back or something to do with their back, all right? Number 3, we've got dementia. Number 4, we've got our lower respiratory diseases, and number 5, lung cancer, all right? So that's burden. And then finally over this side, the last thing I want to share with you is the years of potential life lost, okay? So the AIHW statisticians put together all this data, burden of disease, causes of mortality, age categories, all this stuff. And then they work out this statistic. So this statistic shows and explains that due to early mortality, okay, so basically if you don't live to your expected life expectancy, all right? How many years should you have lived if you didn't experience a condition, all right? And then they add all this data up together. So currently, it was a crazy, here we go. Overall, Australians have lost 5 million years of health due to burden of disease, all right? So that means that if you add up all of the time that people have not reached their life expectancy goals, 5 million years, that's a lot of time, all right? Top causes, obviously, and the big one, which I wanted to draw your attention to, is suicide. If you remember from the previous data I showed you, suicide is the leading cause of death in your age category, and then like the second one in my age category. Is that right? Let me have a look. No, it's in both our age categories. Right? Suicide, you and me. And because that's number 1, that's like, unfortunately, if a young person, so let's say a 20-year-old unfortunately takes their life, and they were meant to live to 84.5 years, okay, that one person has contributed like 64.5 years to the years of potential life loss statistic, all right? And then you add up all of the people that have all of these conditions and they don't reach their life expectancy, then you get these years of potential life lost. So this is an interesting statistic. You may need to refer to it in your multiple choice questions. Like I said, though, you don't need to remember numbers, but you do need to remember pretty much the reason why, and the main one being suicide, unfortunately. Right, so that is the end of this 2023 Statistics and Trends video. Okay, so overall, in case you completely switched off and now you just need the really brief summary again, all of our causes of death are basically trending downwards, except for dementia, which is trending upwards. Life expectancy is continually trending upwards. Infant mortality is continuously trending downwards. That's it. Thanks, bye.